Welcome to Adapt NCLEX. Most students fail the NCLEX not because they don't know the right content. They pick the second best answers. In this video, you're going to take 85 questions, NCLEX practice question readiness exams with me, with rationale. I will show you exactly how to think like the test and use common sense to pick the right answer. Pause the video, answer the question for each question, and then check the rationale to keep track of your record. All of them, I want you to keep track of your record and try to get 65. And if you're able to get more than 65, you're on your way passing. First question, what do you see? Don't worry, they can give you the questions like that. They give you images, click on it, read it, ignore it. And nurse is collecting data on the client in the mental health clinic. The nurse review the clinical data. What condition the client is experiencing based on the data. Read it. Client has a sense of what? Self-importance. Very, very important. Preoccupy with power. Pay attention. And sources. That's grandiosity. Seems entitled and can only be around who are special. Grandiosity. Exploitative for own gain. Manipulative, you can see, and arrogant. Is very arrogant in his speech and behavior. He lack empathy, keyword, and demand admiration. Who does that? Believes others are envious of the current achievement. Who is this patient we are describing? All these things, what do you think? Preoccupied, lack of empathy, everything, I'm on top of you, lack empathy, and they want admiration all the time. It is a borderline patient, schizophrenia, bipolar, and narcissistic. Test taking strategy, common sense. Like I said, I'm going to give you common sense to pick every answer. It cannot be bipolar. It has to be narcissistic. Why? Lack of empathy, arrogant, grandiosity, one will be on top of everything. A borderline is going to split. A little bit manipulative based, bad cap and good cap. Schizophrenia, you know the three things you're supposed to know. Thought impairment, like hallucination. All of them are not there. And disorganized thought. And bipolar will be pacing back and forth. That word is going to be looking for. Patient will be talkative. They may have grandiosity, but they don't look down on anybody. Therefore, number 4 is the right answer. This is a Psych question. This is how they ask you mental health concept. Did you get it right? I know you pick it, your right answer. After a tornado, prioritization. A nurse is assigned to triage victims in the community. Which of the following patients should the nurse prioritize for care? 45-year-old with a closed femur fracture. 28 years old with penetrating chest wound and dyspnea. 70-year-old with confusion and a small laceration of the scalp. 16-year-old with the sprained ankle. Be sharp when you pick your answer. That's adaptive prioritization. Pause the video, pick your answer. You pick your answer? I can tell you, this patient with the chest wound and dyspnea, every time you are triaging, if you have chest wound and there's bleeding and there's a shock patient, those are the patient you see. Chest wound is number 1. Penetrating chest wound and dyspnea, that's airway issue. I got to see you. Closed femur fracture is a fracture. There's no evidence of bleeding. Confusion, small laceration of the scalp. Of course, he's a 70-year-old. Fine. He's not going to die from it compared to penetrating chest wound. Sprained ankle, we can deal with you later. This is prioritization. Number 2. Number 3. After teaching a client with the new prescription of Sumatriptan, NCLEX step, that's what NCLEX will ask you. They love this medication because they say always a mistake from the patient to commit medication error. Which of the following statements indicate a need for further teaching? I will take this medication at first sign of what? Migraine. I may feel chest tightness after taking this medication. I can take this medication to prevent migraine every day. I should avoid taking this medication with certain antidepressant. Pause, pick your answer, keep track of your record. You pick yours, common sense strategy, I go back and say Sumatriptan. Second thing you should look for in the question before picking your answer, further need further teaching. I'm picking the wrong answer. That is the common sense keyword. Now, if I give you Sumatriptan, I've given you an idea. There's nothing in the question that tells you this is what the medication is used for. But you can figure out from the question that there's a migraine here, right? That means, and there's another migraine. That means this medication is used for migraine. You can see the question stem never said that, but the answer choice said migraine. Oh, this is used for migraine. One word. Triptans are used for migraine. Then you said, what if you're taking medication for migraine? Why are you taking it? There's some preventive medication, and there's some that you can use to treat acute problem. This one is for acute problem. Therefore, the right answer is what? Not to take it every day, because when you take it every day, you're going to have trouble. It can cause hypertension, it can cause a bunch of problems. And therefore, I take this medication to prevent migraine every day. No, you take it at first sign of migraine. Another strategy, A and C are saying something different. That tell you they have to be the right answer. It causes hypertension. Therefore, you should take your medication. Okay? That's why you can feel chest tightness after taking this medication. So if you have blood pressure medication, you should take it. It's a serotonin agonist. If you take antidepressant, you may have serotonin syndrome. Therefore, D, you should avoid it. That's the right answer. Need further teaching. And this is formulating a nursing diagnosis for a client with peripheral artery disease. Nursing diagnosis is based on underlying pathophysiology. That's the key word, not the actual thing you're seeing. Which diagnosis is most appropriate? Impaired skin integrities, well, look, related to stasis of blood in the lower extremities. Is PAD related to stasis? Activity intolerant related to pain from intermittent claudication. Fluid volume excess related to what? Volume congestion. Risk for injury related to impaired sensation in the lower extremities. Pause, pick your answer, keep track of your record. You pick your answer? I can tell you, claudication, the right answer is what? Number 2, because activity intolerance. Why? I cannot walk because I have claudication, less blood flow. Why this is wrong? It's not due to stasis, that's venous disease. Fluid volume excess related to venous congestion, venous stasis. Risk of injury related to impaired sensation in the lower extremities. That's the secondary information that can happen, not the primary diagnosis. Therefore, B is the right answer. And this is assessing fine motor development in the group of children at outpatient pediatric clinic, which finding the name should expect as age-appropriate fine motor milestone. Pediatric health promotion milestone. What do you know? Pay attention to the key age milestone, and I've given it to you: 1, 3, 6 months, and 12 months. Which one is appropriate? 1 month old will have a strong palmar grasp. 3 months old will hold and release object placed in their hand. 6 months old will place object in their mouth. And a 9-month-old will move object between hands and as a crude what? Pencil grab. At 12 months, you have a fine pencil grab. Test-taking strategy, common sense strategy to pick these answer choices. You pick yours, it's a selected apply. Don't over-select. Pick those that you are 100% confident. Which one? You are 100% confident to pick. You pick your answer? I can tell you, number 1 is right. As soon as the kid is born, anything you put on in their palm, they're going to grasp it. And that is what? Strong palmar grasp. Then when they realize I don't need to hold it forever, I'm not going to be selfish, they start releasing it. At 3 months, they release the object and it goes back and forth. Now, when you put anything in their mouth, in their hands, they know you got to go to the mouth because they care about food. Therefore, they place object in their mouth. If you can pass it into your mouth, you can pass it to the other hand. So change it between 2 hands, and you have crude what? Pencil grab. If by 9 months you have crude pencil grab, then you should have fine pencil grab. You can hold pencil, you can hold a knife or anything, spoon, because it's now sharp. Your thumb and your first fingers can hold together. This is all expected finding. And next is preparing to administer naltrexone to a client with a known alcohol misuse disorder. Pay attention to that medication. Which of the following finding will require follow-up before administering the medication? Select or apply. You may not know the medication, but what did the answer choice say? Elevated liver enzyme, report of craving alcohol, history of what? Hypertension, mild headache, positive urine toxicity screen for opiate. Go back to the question. Pick your answer choice, and I'll show you how to answer it. You pick yours. I know you picked the right answer. Now, this is the way you should approach the question. Go back to the question stem, and they say what? Naltrexone. I don't know what it is, but I know they can use for alcohol misuse. If I'm using it for alcohol misuse, then I can use it when I prevent you from having withdrawal or craving. So this is what is used for craving. It's used for craving alcohol so that you don't drink it. Now, I said, what would I have to do when I see it require follow-up before administration? If I see something like that, that means I should not give you the medication. Strategy to improve your answer choice. Look, it's an alcohol misuse. Well, if you are craving for alcohol, that's why I'm giving it to you. Now, mild headache, whenever they give you something, they put mild headache there, common sense. You can, well, that means they are not worried about it. If they worry about it, they'll tell you severe, moderate headache. Therefore, this is eliminated. Then you left with A, C, and E. You got to put something. Do you pick all of them? You have to be confident. And you have to know that this is an opiate. That's one thing you should know. Naltrexone is an antagonist to opiate. Therefore, if you have opiate in your system already, this is going to cause withdrawal. It becomes a problem, and you go into withdrawal symptoms. And in addition to the condition that you go on, it's going to precipitate the problem, and therefore, you should pay attention to that. And then it's metabolized by what? Your liver. And therefore, this is a problem. Therefore, elevated liver enzyme and the presence of urine toxicity of opiate is a bad problem. Okay? And next is monitoring a client receiving Pitocin for labor induction. The fetal heart monitor is shown below. Which of the following actions should the nurse take? This is fetal heart monitoring. Select or apply. Place the client in the knee to chest position. Decrease Pitocin infusion rate. Prepare for immediate delivery. Administer oxygen via nasal cannula. Increase the IV fluid rate. Document the finding and continue to monitor. Then you click on it and it said, what is this? It's what you have. You have to read the EKG. How do you read the EKG? Look at it carefully, and then we'll come back to it. Really carefully, then you pick your answer. What do you see? Look at it carefully. Look at the mother contraction and look at what the baby is doing. Now, let's look at it. Based on what you saw, this is what you saw. Look at it. What would be your right answer? That's all. You pick your answer choice. I can tell you this is what? There's normal contraction, 1, 2, 3, 4. So this is good. What is happening when the mommy contract? Here, the fetal heart rate is normal. As the mommy reach at the peak, you see it start coming down. Same thing. If you draw a line going here, at the peak, the baby comes down. Here at the peak, baby comes down. That means this is late deceleration. In late deceleration, how do you manage it? We call it VCHOP mind. So you got to write VCHOP mind. And I said, okay, VCHOP, late deceleration is placenta insufficiency. That means I should improve blood flow to the placenta. Place the client in the knee chest position. That's variable deceleration. No, wrong move. You should not decrease Pitocin. You should stop it. You don't need to do immediate delivery. Stop the Pitocin. Give the mommy oxygen, but not nasal cannula, not rebreather. They will need IV fluid. And then you don't need to continue to monitor. Why? Because the treatment for what? Late deceleration is LION. First, stop the Pitocin, lateral position, IV fluid, oxygen, and notify the provider. So this is maybe hard question, but number 7, I know you got it. You're just paying attention to the keywords and using some strategy to answer it. Don't over-select because you see things. Read the question completely. So there's only one answer choice there. If you over-select, you miss everything. This is late deceleration. Same thing. Which of the following findings and intervention should be expected for this condition? What kind of condition? This is what you have. What do you think? This is the kid, and this is what you see. Look at it again sometime and say, okay, this is what I see. Now, what would I do? The bowel is protruding through the abdomen with protective covering. Is that what you see? Cover the exposed organ with what? Petroleum gel. Initiate oral feeding as soon as possible. Place the newborn in the prone position with the hip slightly flexed. Monitor for fluid loss and signs of what? Dehydration. This is what you saw again. What would you pick? Is it select or apply? Don't over-select. Stop the video. Pick your answer. Keep track of your record. You select your answer. You think about it. I know you picked the right answer. This, I look at it, I say, oh, this is gastroschisis. There's no surrounding. The bowel is out. Therefore, no protective covering. This is unacceptable. But you got to cover the organ. What you use? Saline soak solution, no petroleum gel. Wrong answer. Baby bowel is out. Why would you feed them? Baby has to be NPO, NG2. They need TPN. Place the client in the prone position with the hip slightly flexed. The bowel is exposed. Why would you put them in the prone position? They need IV fluid. They need hydration. They need infection prevention. Cover the bowel with what? Saline gauze, and then some silo, and then prepare the kid for surgery. This is gastroschisis. Only one answer. Over-select, you lose all of them. This is a mental health question. I want you to be comfortable that when you see this kind of question, you're not going to run away from it. Like I said, common sense. I'm going to teach you how the NCLEX think and how to approach them. Read it. And next is returning a call to the home of a client after a routine annual physical exams. Results of the laboratory evaluation show bilirubin is 5 times normal. The client instructs the nurse instructs the client to go to the emergency room. The client responds, this is a mistake. I am fine. What defense mechanism the client is exhibiting? Select or apply. Is this reaction formation? Is this displacement? Is this suppression? Is it rationalization? Or is this denial? What do you think? You have a lab results. It's abnormal. You say, this is a mistake. It's not mine. It's somebody's lab work. What do you think? What would you say? Select or apply. You don't have to pick everything, but you have to know the definition of these defense mechanism. What do you think? You pick your answer? I can tell you the right answer is in denial. The patient said, this is a mistake. I am fine. Never accept the results. Reaction formation, acting opposite to their feeling. That's not opposite to their feeling. They never even accept it. Displacement, taking a bad feeling and transferring to another one. Suppression, putting everything down. And rationalization, making sense out of it. Say, oh, the lab is elevated because I drink alcohol or something like that. But that's not what he said. He said, absolutely, it's not mine. This is denial. Infectious control. Know them. You cover 15% of your test. Know them. Which precaution is appropriate for the following? Client is HIV. Client is Hep B, Hep C, Hep A, who is diapered, CMV, aspergillosis, and E. coli. What do you think? Contact precaution, ask yourself, is it appropriate or not appropriate? B, C, all of them. You got to select. If it's appropriate, select. If it's not, you have to know the precaution associated with it. Pause the video and select your answer, then proceed. You pick your answer, I can tell you, HIV is not contact. That's the precaution initiated. This is not contact. This is inappropriate. Hepatitis B is not contact. It's a standard precaution, inappropriate. Hepatitis C is a standard precaution, appropriate. Hepatitis A is diapered. If you have hepatitis A and there is no diaper, right, and you can go to the bathroom, you have continence, is standard. If you diapered, that's what appropriate, because the nurse has to change it. CMV is what? Standard precaution, not airborne, not inappropriate. Aspergillosis, it affects your lung, but what? It's a fungal. This is not appropriate. And E. coli is not what? Droplet. E. coli is a contact. Diarrhea, dysentery are related to that. Therefore, inappropriate. Did you get it right? I hope so. You keeping track of your score? We have question number 10. How are you doing so far? You should be getting more than 50% so far. And this is where we are. If you're tired, I want you to take a break, get your stamina back, and focus on getting the rest of the answers right. Question 11. A nurse is caring for a client diagnosed with rubella. Which of the following precautions should the nurse implement? Is it precaution, airborne, contact, protective isolation, and droplet? Rubella. Know the isolation for each organism. Recognize them. Rubella is a droplet precaution. It's not airborne, contact, protective isolation. Protective isolation is used for patient who is likely to get sick, immunocompromised. A nurse is facilitating a group therapy session. Which of the following communication by the client demonstrate assertive communication? These are some of the languages you may see in the new generation, new test plan 2026. Assertive communication is nothing. Don't say, oh, I've never seen it before. You know what it is. You know what somebody is very assertive. It's a language problem. I know some of us, we are not from here, but the test is, it is what it is. When you see the word you don't know, try to interpret it. I am not comfortable sharing personal information at this time. I don't want to offend anyone, but I disagree. You are wrong about that. The client remains silent. Which one shows assertive communication? Pick your answer. Let me know. The right answer is A. To be assertive means you telling them how you feel. You don't hold it back, and you're just communicating exactly what it is. I'm not comfortable with what you're doing to me. I'm not going to share my information to you. I don't want to offend anyone. You are not being assertive. Don't care about offending anyone. Do what you got to do. You are wrong about that. Still not showing your feeling. Why do you think they are wrong about it? If you remain silent, you don't do anything. The client reported burning sensation under the tongue after taking sublingual isosorbide. Which of the following response should the nurse provide? Right? The medication may be expired. This sensation is suspected. You should stop taking the medication. Drink water after taking the medication. You pick your answer? I know you pick your answer. This is NCLEX strategy. NCLEX keyword. Go for it. It says sublingual, under the tongue. Any medication under the tongue, you don't drink with it. Therefore, the right answer, expected finding. If you're taking under the tongue medication and it says sublingual, most of the time it's nitrate, isosorbide, right? Sensation. If you put it under the tongue, it's going to burn as it gets absorbed. That's what is expected. The medication has not expired. It means it's working, and you should not stop taking the medication. And next is caring for a client with a new diagnosis of osteoarthritis of the knee, osteoarthritis, right? Which of the following finding would be consistent with the condition? This is like a physiological adaptation question. These are key questions you should be able to answer because this is a big area. Select or apply. It's musculoskeletal, Like I said, merge search form under physiological adaptation. Symmetrical joint involving, crepitus, grating sensation with joint movement, morning stiffness lasting more than 30 minutes, joint pain that worsened with rest and improved with activity, warm red joints with severe inflammation. Or every time they give you osteoarthritis, they're going to confuse you with what? Rheumatoid arthritis or septic arthritis. But which one do you think is specific to osteoarthritis? Know the difference. Pause, pick your answer, keep track of your record. You pick your answer? I can tell you, osteoarthritis is key, right? It's different from rheumatoid. Rheumatoid is inflammatory process, right? And osteoarthritis, there's no inflammatory process. Osteoarthritis, whenever you hear about it, think about the old man that always complain about their knee, my knee hurt. They never say 2 of my knee hurt. They say 1 of my knee is always hurting. Therefore, it's not symmetrical, it's asymmetrical, one side. What is the problem? It's due to wear and tear, and therefore there's crepitus. If you push on it, you can hear, and you can hear grating sound with the joint movement. This is right. They're going to have stiffness, but the stiffness is shorter. It shouldn't last more than 30 minutes. If it lasts more than 30 minutes, it's due to rheumatoid arthritis. So this is wrong. The joint pain, pay attention, worsens with rest and improve with activity. It's the opposite. Osteoarthritis due to wear and tear. When they rest, they get better. When they move, it hurts. Rheumatoid arthritis is the opposite. When they rest, they get worse. They like to move because the joint gets stiff when they are rest. Therefore, this is wrong. And since there is no inflammation, there's not going to be warm, red joint, and severe. I'm using common sense to show you how you pick the answer choice. Even if you don't know, you don't rush. Read each word and make sure each word makes sense. And therefore, one answer alone, over selection, you get 0. And this at 14-week gestation, provide care for a client prescribed what? Dutasteride. Which action by the nurse is appropriate? Question the prescription, educate the client about practicing, wear gloves when handling the medication, request a prescription for Foley catheter. Think about it. Pick your answer. Pause the video. This is a pharmacology question. You pick your answer? Now, this is the way I'll approach it. Then I'll show you the answer. I don't know what kind of medication because there's nothing here. But there's a reason why I give you a patient who is 14 weeks. That means she's pregnant. There's something related to the medication about pregnancy. And what? The steroid. I don't know, but I've heard something about steroid. Pharmacology always go back to the baseline. Have you heard about finasteride? That means this is used for prostate. BPH is the same thing. You shouldn't worry about the you don't know what about steroid. Always when you master pharmacology, look at the last name. Finasteride, steroid. That means it's a BPH medication. But why would they give me pregnancy? That means something related to that. Pregnancy, you can give certain medication. The most important medication you should stay away completely are the chemo drugs because they're very, very toxic. They can spill everywhere. But these medications can also affect you. The problem is you should not handle it. You can wear gloves. So questioning it is not the right thing. This is for the patient. You can give it to the patient, but when you're giving it, you have to wear gloves. It has nothing to do with priapism. I told you BPH, common sense strategy. For your NCLEX, every time you hear about priapism, think about what? What medication should you worry about? Trazodone. Think about trazodone every time you hear about priapism. Wear gloves when handling it. Maybe that may be right. Why do you need a prescription for Foley? If you know the medication is for BPH, it's going to open things out and flow blood and urine will flow. Therefore, I'm going to pick C. If you get it wrong, it's fine. You know how to approach it now. You know the content now. This is a medication that you should not handle it. It's teratogenic, but the nurse can wear gloves to give it to. If it's a chemo drug, yeah, you should stay away completely. Which of the following instructions should the nurse provide? The pregnant client called the clinic reporting about rubella. I've been exposed to rubella. What should you tell them? Come to the clinic immediately. Come to the clinic at the end of the day. Receive the rubella vaccine. Stay home and monitor your symptoms. That's taking strategy and common sense. Think about it. Patients said, I have been exposed with rubella. Do I have infection or not? I don't know, but you know rubella is contagious and you're pregnant. What do you tell them? Do they come to clinic? Pick your answer. I can tell you, strategy, they should not come to the clinic because of what? Exposure. To come at the end of the day, you still have to see them. If you come immediately, they expose everybody. At the end of the day, there's nobody. You don't get a vaccine if you already be exposed. At the same time, she's pregnant. She can't get a vaccine. Common sense strategy. Stay home and monitor your symptoms. She's going to get sick. And then suspect that a colleague is impaired while on duty. Which of the following actions should the nurse take? Confront the colleague, report the observation to the supervisor, confirm the suspicion before reporting, document the behavior, and take no action. You can see that impaired safety, this is a safety question. NCLEX loves safety, infectious control. This is NCLEX strategy. Pick your answer and I'll give it to you. You pick your answer? I know you got to follow chain of command. If the patient, the nurse is going to give the medication right away to the patient and they're impaired and they're going to cause harm, you confront the nurse. Right now, you know that they're impaired. They're not administering any medication. They're not going to cause any problem. You follow the chain of command. So A, you confront them if it's right at the point they're giving something to the patient and you know they're impaired, right? You should not confirm the suspicion before reporting. You don't need to. And you document the behavior and no action. That means you're causing problem. Things bad can happen. And next is caring for a client who has been receiving what? Cognitive behavioral therapy for depression, CBT. Cognitive behavioral therapy. I'm emphasizing it again. That's what you can use to answer the question. Which of the following client statements indicate a correct understanding of the therapy? I will exploit my unconscious thought to understand my behavior. I will learn how to change my negative thinking pattern that affect my feeling. I will focus on my past experience to resolve current problem. I will rely on medication to control my symptoms. Go to cognitive behavioral therapy. Mental health concepts are not that difficult if you know strategy. The strategy is the name of the condition or the concept they give you. Cognitive behavioral therapy. Pause the video, pick your answer. You pick your answer? I can tell you the right answer is in what? CBT. Cognitive, your brain, thinking, and your behavior. Which answer choice say that? This. I will learn how to change my negative thinking, that's T, thinking, pattern that affect my feelings, my behavior. So look for cognitive behavioral thinking in the answer choice. I will explore my unconscious thought. It does not think about changing your behavior to understand my behavior, right? You are understanding it. I will explore it. No, you're changing. That's the key. Not explore your unconscious. Your conscious, you can't get there. You want to know what you understand. I will focus my past experience. Past experience is not. You changing your thinking. I rely on medication. You're not changing your thinking. A is a trap. That's what the NCLEX will give it to you. Watch for that. Unconscious thought to understand my behavior. No. You're changing your thinking pattern to affect your behavior. That's why we use it for cognitive behavioral therapy, like obsessive compulsive disorder. Focus on identifying changing negative thought pattern that influences emotion and behavior. It is goal-oriented, present focus, and teaching cooperation. And this is caring for a newborn delivered by a client with the what? Rubella. Mommy has rubella. You know rubella is infectious. Which of the following actions should the nurse take? Administer rubella vaccine, initiate skin-to-skin contact, place the newborn in isolation, and transfer the newborn to the well baby nursery. Which action should you take? Which one is appropriate? Pick your answer and let me know. You pick your answer? Baby probably is being exposed. Therefore, the right answer, isolate the baby so that they don't infect other kids. Where baby nursery, everybody is going to get infected. Skin-to-skin contact, get more exposure. Administer rubella vaccine? No, kid is too young. And next is teaching a client who is what? Prescribed nitroglycerin sublingual tablet for angina. The client report experiencing headache after taking the medication. Which of the following response should the nurse provide? Stop taking the medication, take acetaminophen for headache, go to the emergency department immediately, drink a full glass of water after taking the medication. You saw a similar question. That was the NCLEX will ask you. They're testing your stamina. If you get the other one right and you mix this, they can figure it out. You probably guess they will go back to sublingual or nitrate therapy again. You pick your right answer? I know you pick it. And the concept is what? Sublingual, under your tongue. Therefore, no water. This is wrong. And if you experience headache, it's causing vasodilation. That means it's working. Therefore, treat the headache, not that the medication is not working. Medication is not working. Treat the headache. You don't need to go to the emergency room. As you treat headache, you take pain medication, acetaminophen. And next is reviewing laboratory results for a client with systemic lupus erythematosus, SLE. Which findings should the nurse prioritize? Important, NCLEX prioritization. This may be risk reduction, at the same time, prioritization. Positive anti-nuclear antibody. When you see it, should you worry that is the most important thing you should worry about SLE? Elevated erythrocyte sediment rate, ESR. Should you worry that is part of the issue? You should worry about it if you see an SLE patient. Hemoglobin of 11.5. Should you worry about it when you see it in an SLE patient? Or proteinuria or urine analysis? Pick your answer. Let me know. The concept here is what? Systemic lupus, when you see kidney is in trouble, that's a bad problem. Nephropathy is the early signs of complication, and they're getting to the point that they're getting end stage. They may die from their disease. Therefore, proteinuria is something when you see you should worry about. ANA is the diagnosis of SLE. SLE is inflammatory autoimmune disease. You're supposed to see elevated ESR. They're going to have anemia expected. Therefore, E is bad. And let's care for a pediatric client with cystic fibrosis. And what does the question say? Airway clearance. What do you do to clear the airway for cystic fibrosis? Chest physiotherapy. Who's going to do chest physiotherapy among these people? Physical therapists. Nutrition, it's about food. Social worker, it's about helping with the discharge. Clinical nurse specialist is the nurse who cares for, and therefore physiotherapist will be the one providing chest physiotherapy. Which of the following should be included in a plan of care? What is the problem? Client is brought into the emergency department after being found wandering several miles from home. The client is unable to recall personal information, appears confused, and states, "I don't recognize anything around me." There is no evidence of substance abuse or neurological impairment. Keyword. A few minutes later, buzzword, the client begins speaking with what different name and describe completely different background and lifestyle. Once again, client is brought into the emergency room. Client is brought into the emergency department after being found wandering several miles from home. The client is unable to recall personal information, appears confused, state, I don't recognize anything around me. There's no evidence of substance abuse or what? Neurological impairment. A few minutes later, the client was saying what? Speaking with a different name and describe completely different background and lifestyle. Mental health concept. Which of the following should be included in a plan of care? Encourage immediate discussion of past traumatic experience, challenge the client's statement to promote awareness, provide a calm environment and assist with reality orientation, minimize interaction to reduce overstimulation. What do you think? You pick your answer. That's the case. I can tell you this patient is suffering with what? Dissociative identity disorder. It was fine. He came in, they find the patient, they don't know where it is. All of a sudden, boom, he's a new patient. A few minutes later, he's talking about something else. It's a new name. He described him completely different. That's dissociative identity disorder. You give them time to integrate. You don't force it. But you can bring them to reality and let them know what is going on. A nurse is caring for multiple clients on neurological ward after change of shift. Which client finding is most concerning and require immediate intervention? A client with myasthenia gravis who report increasing difficulty swallowing. A client with what? Multiple sclerosis who report numbness and tingling in the hand. A client with ALS who report muscle weakness in the hands but is breathing comfortably. A client with Guillain-Barré syndrome who report rapidly worsening shortness of breath and difficulty speaking. Prioritization. You got to be sharp. Who do you see first? Who condition require immediate intervention? You pick your answer? They are all neuro patient. You pick your answer? Yes. I know you pick this one because he's a GBS. He has shortness of breath and worsening difficulty speaking. Don't pick A. I know they too have difficulty swallowing, but the presence of worsening shortness of breath make this just difficulty speaking, maybe having aspiration, maybe something. But this one is already affecting the lung. Therefore, they have a shortness of breath. ALS, you expect them to have weakness. And multiple sclerosis, you expect them to have tingling in their hand. Not a bad problem. The nurse is teaching a client with newly diagnosed Parkinson's disease. Which of the following the nurse should recognize as the cardinal feature of the disease? What is consistent with Parkinson? What is number one thing? Is it intentional tremor, resting tremor, vision changes, and fall? You pick your answer. Resting tremor, P rolling, resting tremor, rigidity. When they don't want to move, their hands is already shaking. Intentional tremor is what everybody does. Sometimes you move your hand and you have tremor. That's intentional, right? But resting, when you see there, you don't do anything. Vision changes is not classic. They may fall, but that's not the major problem. Which client is most likely to be a victim of elderly abuse? 80-year-old with male with diabetes, 80-year-old female with cirrhosis, 80-year-old female with Alzheimer's, 80-year-old male with left-sided stroke. Who is usually will be abused? You pick your answer? Let me know. I can tell you who. C is the right answer. What is the key? Write this down. This is mental health concept you should be familiar with. Old age, they are all 80. It's always a problem. Female, more likely to be abused than male, and somebody with a cognitive problem. This is a chronic condition, but cognitive problem is more likely to cause you to get abused. Therefore, that's the right answer. Female, sex, age, physical and mental impairment are the rates for elderly abuse. Next Generation NCLEX. Are you ready? Question 27. This is a 6-part question. Get ready. Let's get this done. Client is what? 3 days post-abdominal surgery with the history of myasthenia gravis. For Next Generation NCLEX, the first 3 sentences has to be your cue. You have to figure out what is wrong with you. Patient had surgery and had myasthenia gravis. I'll give you the key as I read. The client reported worsening muscle weakness after surgery, 3 days in the evening, and difficulty swallowing. Right? Myasthenia gravis, how should they behave? Weakness, it progresses during the day, right? But this one is a what? It's worsening now. The client state, I feel more tired as the day goes on, and it's getting harder to keep my eyes open. Ptosis, right? They usually are stronger during the day, then you get weaker. But after surgery, this is getting worse. Temperature normal, heart rate is very high, blood pressure is high, respiratory rate is high, saturation is going down. Patient is anxious, they have bilateratosis, their speech is soft, it's affecting their speech and is slurred. Lung is fine, abdomen is soft, appropriately tender, they have hypoactive bowel sound because you just had surgery. And strength is 2 out of 5, weak, and he has myasthenia gravis and that. What do you think? What is the patient suffering from? It looked like myasthenia gravis, but it's getting worse. Is it crisis of myasthenia, hypertensive crisis? Look at the blood pressure. 160/90. Is it Guillain-Barré syndrome, right? And is this cholinergic crisis? You pick your answer, pause the video, put it down. This is myasthenia gravis. It can be hypertensive crisis. I'll talk more about hypertension. This is just patient surgery, and then all of this things is going on, and the changes is talking about myasthenia, ptosis, what? Weakness during the as it progresses during the day. It can be Guillain-Barré syndrome. The patient has myasthenia gravis. How can that switch? Common sense. Cholinergic crisis, I have to give you cholinergic agent. I have not given it to you, therefore you good. Which of the following can trigger what? The problem, myasthenia crisis. Is it infection, overdose of anticholinergic medication? Is it surgery? Is it setting antibiotics, emotional stress, or hypertension? What usually causes that? You pick your answer. Trigger for any autoimmune disease that will worsen infection is usually one. That's why you get your immunization. If I give you anticholinergic medication, that means you're going to get more acetylcholine will lead to cholinergic crisis. That's a trap, NCLEX trap. Pay attention. Surgery, patient just had surgery. That's what is causing that. Setting antibiotics like aminoglycosylate and emotional changes will do that. Hypertension is the condition that will result by not a trigger. What treatment, therefore, anticipate in myasthenia crisis? You can see the patient vital signs is going down, respiratory rate is going up, blood pressure going up, I'm getting tachycardia, I'm getting weak, I have slurred speech. All these things should give you a clue that this is a bad problem. If you don't do anything about it, they get into trouble. So myasthenia gravis crisis, you give them atropine. Do you give them stigmine, pyridostigmine? Do you give them steroid? Do you give them immunoglobulin? Do you do plasmapheresis or prepare to intubate them? This is very, very important. Pay attention to that. You pick your answer. You don't have to select everything. You select or apply. Pick those that you're 100% confident. Atropine, what is it going to do? It's going to block the acetylcholine. It's going to worsen it. Pyridostigmine will give you acetylcholine, but in this condition, they are not good. It takes some time. You want something that will work very fast. So the best thing is to take their blood and wash it through plasmapheresis to remove all the antibody that is triggering the crisis. And then you give them immunoglobulin, and steroid may help them. They should be ready to be intubated. This is what you do in crisis associated with the myasthenia. The client has no ptosis now. He has dysarthria. His motor scale strength is now 4 out of 5. His respiratory rate is 18. His saturation is 88. He has hypoactive bowel sound. And then say, which finding indicate the client is improving? When you see this kind of question, go back to the original. I see what? There is no ptosis. Therefore, what do I say? There is bilateral ptosis. Therefore, I know this is improving. And I'll go back. Presence of dysarthria. Oh, what do they have? They have slurred speech and a soft speech. They're getting dysarthria, almost the same. It has not improved. Oxygen saturation, what is it? This is 88. I go back and I have what? 92. They're not improving. They're going down. Hypoactive bowel sound. I said, oh, they stay at hypoactive bowel sound. Respiratory rate. What happened? It's 16 here. What was it before? It was 23. That means you're improving. And therefore, that one is okay. The client eventually require endotracheal intubation. So intubate the patient due to respiratory failure. 6 hours later, the ventilator alarm starts sounding, high pressure alarm. Which of the following conditions should the nurse suspect? It's the same concept. Don't say this is the case study, they taking me. You know what is the high pressure alarm. If I say what are the conditions will cause high pressure alarm, just pick any of them you want. Pick endotracheal tube, increased airway secretion, bronchospasm, self-esteem, circuit disconnected, and calf leak. I'm trying to connect all the things, concepts you need to know in a case study so that you can master them. What do you think? High pressure alarm means obstruction. Which of these indicate obstruction? Think. Secretion, obstruction. Bronchospasm, obstruction. Self-extubation is a leakage. Disconnected is a leakage. Calf leak is a leakage. Therefore, those are your right answers. The client underwent tracheostomy. We put the tracheostomy in after 3 days of endotracheal intubation. That means we intubate the patient. Now we put tracheostomy on the morning of post-operative day 4. So they place trach. 4 days later, the client coughed forcefully and resulting in the dislodge of the trach tube onto the floor. So the trach fell out from the neck. The client is in respiratory distress. What should the nurse do first? Prioritization, risk reduction. Call a rapid response. Attempt to reinsert the tracheostomy tube back, cover the stomach with sterile gauze, and provide ventilation using a bag mask over the stomach. What would you do? He has a tracheostomy. It's been 4 days. He cough. They think come out. What would you do? Bag them, cover the O, put the tracheostomy tube there back and give them oxygen through that, and then call a rapid response. The key concept here, less than 7 days after tracheostomy, never put it back. Therefore, B is wrong. Calling the rapid response is too late. Best thing to do is to give them bag masks. This is NCLEX strategy. Next generation NCLEX key concept you should memorize and know. How did you do? What did you get? Did you get all the answers right? I hope so. Number 28. A client with severe monohydria, that means bleeding, is prescribed an iron supplement, oral one. Which of the following instructions should the nurse include? Select or apply. How do you take iron? What instruction do you give to the patient? Take the medication with milk to improve absorption. Take the medication with orange juice. Take the medication at bedtime with what? Antacid. Expect stool to become pale in color. Take the medication between meals to increase absorption. It's a thing you teach the patient about how to take iron, whether it's a kid or adult. It's a strategy and it's a concept. You pick your answer. I know you pick it. Which one were your answers? Put down in the comment. But no milk with iron. You should take it with orange juice. Antacid. Stay away from iron. It affected. Your stool is not going to be pale. It's going to be what? Brown, right? It's going to be red, a little bit dark red. And you should take it empty stomach. Therefore, take the medication between meals. It means empty stomach. After you eat, meal in between them. So later, 2-3 hours later, this will increase absorption. Take it with the orange juice. No milk, no antacid. That's the key with iron. And you can take it with vitamin C too. This will help with absorption. The next is aware of 4 pediatric clients in the emergency room. Which client should the nurse see first? A 4-year-old with yellow fever and a recent flu. 4-year-old, he fell down the stairs and there's laceration and there's what? Nasal clearing discharge from his nose. A 10-year-old, he has projectile vomit, he's crying and he has scaped abdomen. A 6-month-old, he has painless scrotal swelling which transilluminate with no acute distress. Prioritization 101. Be sharp. adapt NCLEX with. You find what is wrong with each patient. If it's an expected finding, ignore it. If it's not, pick it. I can tell you, the right answer is this kid. You fell, you hit your head, and there is clear nasal discharge, that's CSF. This patient has basal skull fracture. Projectile vomiting, crying, and scaffold abdomen, 10-month-old pyloric stenosis. Dehydration, of course, I never told you anything, therefore, don't worry about it. You have scrotal that is swollen, and you can translate light through, that is what? Hydrocele. And if I give you flu, you're going to have fever. Don't worry. And let's provide care for a client with asthma and prescribe what? Oral steroid. You're taking steroid. Which risks associated with the prescription the nurse should include in discharge? That means if you take steroid, what are the side effects? Retinal detachment, weight loss, abdominal striae, acne, adequate wound healing, and psychosis. What it means is the same thing. Change it to Cushing. If you're taking steroid, you are like a Cushing patient. Answer it like a Cushing. What are the things you know about Cushing? Use it to answer the same question. Question 30. I'll give you a clue so that you can get it right. That's the common sense strategy to approach it. Steroid, what do you think? It causes cataract, not retinal detachment. It causes weight gain, not weight loss. You're going to have abdominal striae, excessive steroid. You're going to have acne. Your wound healing will decrease, inadequate. And you can have psychosis from steroid. These are your right answer. Endocrine, physiological adaptation. I'm covering every portion of the NCLEX, going through all the ideal facts, and are using the same distribution. So if you're taking these tests, you're getting sample readiness exams. Delegation. A registered nurse, LPN and UAP are caring for assigned client. Which of the following activity will be the most appropriate for the nurse to assign to the LPN? Everybody stay in their lane. RN do their stuff, LPNs do their stuff, and UAP do their stuff. Which one should you give it to LPN? Provide discharge teaching to a client post-appendectomy, measure the initial vitals before blood transfusion, administer tube feed to a client with gastrostomy tube, measure a client with what? Chronic venous disease for graduated compression stocking, record urine intake and output for a client with the heart failure. Which one is good for LPN? I know some things the LPN can do and UAP can do, but if everybody is there, everybody stay in their lane. What do you think? Providing teaching, no, that's an RN job. Measure the initial vitals before blood transfusion. What do you think? That's UAP job. Administer tube feed to a client with gastrostomy. Yeah, they can deal with tube feeds. Measure a client with chronic venous disease for graduated compression stocking. They can take care of it. Record urine intake and output for a client with the heart failure. UAP job. Don't worry about it. The next care for several clients. Which finding the nurse should match with appropriate diagnosis? That means what is associated with it. Appendicitis, cholecystitis, pancreatitis, diverticulitis, which is associated with it. Who's going to have what? Murphy sign. Who's going to have ileus? Who's going to have McBurney pain? Who's going to have left lower quadrant pain? Which one? What do you think? Let me know. You pick your answer, pair them. Appendicitis is associated with the McBurney. Cholecystitis, they have Murphy sign. That's right upper quadrant pain. Pancreatitis, you're going to have ileus, bowel slow down. And diverticulitis have left lower quadrant pain. It's concept you know. In a question form, don't let the NCLEX take it away. I know you mastered them. And next, after educating a new graduate on diabetes insipidus, physiological adaptation, which fluid choice the new graduate should anticipate when caring for a client with diabetes insipidus? 3% normal saline, 5% dextrose in water, normal saline, lactate ringer, and 0.45% normal saline. You got to bring your content. You got to go for the diabetes insipidus. What should you expect? And pick the appropriate condition. Fluid that is needed, fluid electrolyte, at the same time physiological adaptation. You pick your answer. Go back here. This is the way you should answer it. Diabetes insipidus, what is the problem? You have no ADH. Therefore, your urine is going to be what? Dilute. And your blood is going to be concentrated. That means what? Your sodium is really high. So you have hypernatremia. You got to bring the sodium down. Why would you give them 3%? 3% will raise it up. 5% dextro in water. That's water. Water will bring them down. Normal saline. Why would you give them sodium too high? It will bring them up. Lactate ringer is not used. 0.45% half will bring them down. Therefore, B and E are your right answer. This is how you do fluid and electrolyte question. You have to know how each of them work. And that's the concept associated with it. When caring for a client with the UTI, which nursing activity are appropriate for the RN to delegate to the UAP? Select or apply. Record urine output. Teach the client how to use the unit in the urinal. Assist the client to the bathroom. Administer oral levofloxacin and monitor urine output. Which one UAP can do? Remember, ADL and anything that does not require taking. They can record urine output. They cannot teach. They can assist the client to the bathroom. They cannot give medication. They cannot monitor urine output. It has to be monitored by what? LPN. And this is caring for a 67-year-old stroke client who has stopped wrist restraint due to what? Agitation, attempt to remove their feeding tube. Stroke, trying to remove pulled lines and IV fluid feeding tube. The client is now calmer and responding to verbal instruction. What is the most appropriate? So first they pulling things, and now they calm. What will we do? Keep the restraint in place since they were previously needed. Remove the restraint and monitor the patient closely. Loosen the restraint but keep them in place in case agitation returns. Obtain another provider order to continue restraint use. Patient was agitated, trying to pull things. We requested for self-restraint. Now they're fine. They're calmer, they're responding to everything. What would we do? Ethics question. I can tell you, you should remove the restraint and monitor them. You use it when you need it. You don't need it right now. It's fine. If you keep the restraint, then that means you are committing battery. They're not supposed to be in the restraint because they don't do anything anymore. Obtaining a provider order to continue with the patient, you don't need the restraint. Always assess for the necessity of the restraint. All the answers are talking about keeping it, even though there's no necessity to keep it. Which of the following client the nurse should suspect as highest risk for IV complication? When they give you that question, think about older patient, fragile IV, using IV in the wrong way. That's the buzzword. That's the concept. That's the common sense approach to answer that question. Therefore, which one? 78-year-old patient. He has fragile vein, receiving IV fluid. 30-year-old patient with the peripheral IV site receiving chemotherapy. 45-year-old patient receiving blood transfusion through a central line. 25-year-old patient with 18-gauge IV catheter for hydration. A 60-year-old patient with anticoagulation within the peripheral. What is going to cause complication, bleeding, or any other thing associated with the IV? Question 36. Which one do you pick? Select or apply. Don't over-select. Pause the video. Analyze the question. Pay attention to the buzzword. Use the common sense strategy and pick your answer. Which one would you pick? The fragile older patient vein is in trouble. Chemotherapy through peripheral line is a trouble one. Transfusion through a central line, good, that's the best. 18 gauge is a big needle for hydration. You don't have complication with it. But anticoagulation through a peripheral line, it can blow up. Therefore, those are the ones that will have complication. And this is caring for a client with left tip fib fracture who require cane. How do you use cane? Which teaching is effective? Assistive device. Safety question. Select or apply. Hold the cane on the right side. Keep the elbow at 45 degrees. Move the cane and the left leg together. Cane level with the greater to center. Cane 10 centimeters from the side of the affected leg. Pause. Pick your answer. Keep track of your record. As usual, adapt and close way. Be aiming over 65. This is the portion of the test that people get tired. It's halfway and you're tired. You don't know how you're doing. But I want you to stay focused. Train yourself like the NCLEX. This is where you lose focus. But stay sharp. Keep on doing what you're doing. Don't change your strategy if this is your rare exams. The key is assistive device. You're going to hold it at the stronger side. So hold the cane on the right side. This is left, therefore this is good. The elbow 45 is too big, usually 15 to 30. You move the cane and the left leg. The cane and the left leg it will support the movement of the affected leg. Therefore, this one is good. The cane is level to your greater to center. That's the most important. And the cane 10 centimeters from the side is too far. Therefore, wrong answer. You're going to fall. And then profile curve will climb what? Tetralogy of falling. Which finding is concerning? What do you know about tetralogy of falling? And what condition, when you see, you know patient is in trouble? It's a young kid. Cyanosis when you feed them. Cyanosis when they're crying. They have polycythemia vera and holosystolic murmur. Expected finding. This is the prioritization strategy adapted class tell you based on your content. Content prioritization. What do I see? Pick your answer. Let me know. But I can tell you, tetralogy of Foley is what? It's a right to left shunt. Therefore, when you feed them, they're going to have cyanosis. When they cry, they're going to have cyanosis. They're going to have holosystolic murmur. Polycythemia vera, it means what? Severe hypoxia. The hemoglobin is high. They're going to have clot. They are in trouble. When you see polycythemia vera indicate, that means blood is so thick, it's hypoxic, it's slow. We got to do surgery right away. This is your priority. All this thing, cyanosis, feeding and crying, expected. The UAP report to that a client abdominal dressing is saturated with blood 1 day post-surgery, which tasks can be delegated to the UAP. So the UAP went to the nurse. They said, the dressing is saturated with blood. What task should the nurse delegate to the UAP? Obtain new dressing supply, change the dressing, palpate for abdominal distension, notify the provider. They came to report dressing is saturated. What do? You tell them to go change it, obtain dressing, or change the dressing, or check for abdominal distension, or notify the provider. You know delegation, right? Assessment, teaching, all of them done by RN. So they can call the provider, they can do assessment, palpating the abdomen, changing sterile thing, they cannot do it. Go get a supply and let me do it myself. Next Generation NCLEX. Don't worry, I got you. 40. Read it, pay attention to the first two lines, figure out the diagnosis, use the diagnosis to answer any subsequent question. What is the problem? Client with what? Recurrent nose and gum bleed. That's the bad way. Anybody who bleeds and is recurrent, think about something is wrong with their clotting factors or platelets. There's no sick contact. That means they did not get exposed to any sickness. They're not taking any medication. That means it's not due to medication. It just happened. Easy bruising. Whenever you see that, that's a platelet problem. Vitals, normal. Okay. Bleeding gum. A platelet problem. Petechia. Platelet problem. You see the strategy? I got it from the first general. And everywhere I go, I'm just using it to combine it. I'm not bothering myself. What is petechia? I say, oh, platelet problem. Pinpoint spot and bruising with different stages of healing. It means petechia, the same thing. The platelet is low, 90,000. But they are normal size. That means we are not destroying them in a different way. There's something destroying them. The RVC is normal, hemoglobin is normal, and the Y count 10,000. Therefore, you know there's nothing I'll show you. But based on that, I'll give you the clue. I don't want to give the answer away. Is this a plastic anemia? Is this idiopathic thrombocytopenia purpura? Is this thrombotic thrombocytopenia purpura? Or is this acute leukemia? Pick your answer, stop the video, and let me know. What do you think? What do you think? It cannot be leukemia because what? If it's leukemia, red blood cell will be low, they will be small, Y count may be high or low, platelet will be low, everything. They have what? Pancytopenia. It can be a plastic anemia because that's what is going to happen. Not the platelets will be low, but RBC and in WBC, everything is going to go down. And thrombotics is thrombocytopenia, it will be related to thrombosis and other things. This is idiopathic thrombotic thrombocytopenia. We don't know what happened all of a sudden. And the other reason too is thrombotic thrombocytopenia, the platelet size are not going to be normal. That's another reason if you want to know. Select 2, action the nurse should take based on the condition. Bow tie question. Is it bow tie question? You can see. Select 2. If your platelet is in trouble, then you should not give them iron medication. You should not give them aspirin. Initiate neutropenic precaution is not leukemia. Preparation for what? Steroid. Is that what you want to do? But they said, select 2. Why would you give them aspirin? That's the strategy. You see what I'm trying to tell you? Sometimes they will trap you. Would you give them neutropenic precaution? No, because it's not leukemia. If your platelet is low, you should never give anybody aspirin. What is the treatment then? Iron medication. Avoid it and give them steroid. That will help with the situation. If you do that, select 2 parameters you should monitor. Then if I give you steroid, hyperglycemia. Monitor for bleeding from IV site. Excellent. If I give you steroid, your sodium go up. It's not going to go down. And your potassium go low. That's the answer choice. Bow tie question on what? Idiopathic thrombocytopenia. Based on the condition, you can see. Look at it well. When you see it, don't go wrong from it. And let's provide care for a client with what? Addison disease. What do you expect in Addison? Which finding the mean should anticipate on assessment? Bronze pigmentation, vitiligo, hyponatremia, hypokalemia, hyperglycemia, and weight gain. Is this what you see in Addison disease? Pick your answer, stop the video, and pick your answer. What do you think? Addison disease, there's no steroid, there's no aldosterone, everything is gone. Therefore, what do I see? Bronze pigmentation, which is associated with the vitiligo. Your sodium is going to go low. The potassium is going to go up. Your glucose is going to go low, and you're going to have weight loss. This is what you should expect in Addison disease. Which of the following assessment is the most crucial for the nurse to perform first? A client presents with the signs and symptoms for what? Acute pancreatitis. Assess their pain, monitor their vitals, check for abdominal distension, and then obtain history of alcohol. Prioritization. Which one you think is very, very important to figure out what is going on with this patient so that they don't get complication. You check for their pain level. Do you assess for monitor for their vitals? Do you check for abdominal distension, obtain history of alcohol abuse? What do you think? The most important is how sick is the patient in. I know they're going to get pain. I know they're going to get abdominal distension. Alcohol is not going to help me right now. I got to check their vitals and make sure they're stable. And this is assigning care for LPN on the medical surgical unit. Which start is appropriate? Develop a plan of care. Evaluate the effectiveness of pain medication. administer oral medication to a client, perform admission assessment. What can the LPN do? And I call it MMR most. Pick your answer. Let me know. Developing plan, RN job. Evaluation. They can what? Monitor, but they don't evaluate. They can give gross medication. They cannot perform admission assessment. Therefore, this is your right answer. Which specimen collection task should the nurse delegate to a UAP? UAP. Collect wound drainage for culture, obtain urine from the Foley catheter for culture, draw blood for lab test, collect a random stool specimen. Which one is okay for the UAP to do? It's a trap. They got to do unsterile one. Which one is unsterile? Random stool sample. Drawing blood for lab test, it has to be sterile. Urine from a Foley catheter, not the bag, sterile. And collecting wound dressing for culture, sterile. Random stool sample, no, sterile. A 45-year-old with alcohol withdrawal is agitated, aggressive, attempting to hit the nurse and pull the central line. The provider order what? 4-point restraint. Which of the following actions should the nurse take? Select or apply. Patient is being prescribed a restraint. What would you do? Ethics and restraint fundamentals. Ensure a provider evaluates the patient within an hour of restraint application. Perform circulation and skin integrity check every 15 minutes. Tie the restraint to the side rail for security. Provide range of motion exercise every 2 hours. And leave the restraint in place until the provider discontinues them, even if the patient is calmed down. We saw a question like that. What do you think? Which one is appropriate? Stop the video, pick your answer, don't overselect, make sure it makes sense, be consistent with the question and the concept, and use common sense. Well, provider need to evaluate the patient after they place the restraint, make sure they are not getting into trouble. You got to perform circulation, check every 15 minutes. Tie the restraint to the side rails. It's not good. Bed frame. Provide range of motion exercise every 2 hours. Good thing to do. You cannot leave the restraint if the patient is fine. We got to remove it. Always assess the need for the restraint. That's the concept I want to take from these questions. The next, provide care for a client with Kawasaki disease. The next, administer Mantoux. Which action by the nurse is priority? Administer the prescribed IM influenza vaccine. Obtain EKG immediately. Monitor for lung fractures. Notify the healthcare provider with increased urine output. Kawasaki, they need Mantoux. What do you think? Because they may be fluid overloaded. Therefore, what do you think you need to do? You should check for lung crackers because of what? Fluid overloaded. When you pull all the fluid, it has to go to the lung. You take the fluid from the extremities, then you take it to the lung. The lung get overwhelmed and they get into trouble. You don't need EKG. These people, they don't need influenza vaccine at this time because you give them Mantoux. It's the unrelated. If you give them immunoglobulin, they have to wait for 6, right? They have to wait for what? 6 weeks, 6 months, because that's the problem. Notify the healthcare provider with the increased urine output. I expect them their urine output to increase. Therefore, I'm not caring about it. And as I attend the staff education about end-stage liver disease, which lab results the novice nurse should recognize is consistent with the liver disease? You have platelet, INR, PT, bilirubin, ammonia, protein, hemoglobin. Which value is consistent? You got to select whether it's supposed to be high, low, or normal. What do you think? I have end-stage liver disease. Which one is consistent with end-stage liver disease, high or low normal? Pick your answer. Is the platelet going to be high or low or normal? Is the INR going to do the same? Stop the video, pick your answer, and I'll give you the answers. I can tell you, when you have end-stage liver disease, your platelet, what is going to do? It's going to be low because your spleen get bigger and absorb all the platelet. You have sequestration. Your INR will look like you're on what? Coumadin. You get higher. Your PTE, it has what? Nothing to do with it. That's what? Heparin. Therefore, it does not change normal. Your bilirubin is going to go what? Up. Your ammonia, be careful. I said end-stage liver disease. It does not mean that they have encephalopathy, and therefore it's going to be normal. Protein is going to go low because the liver makes protein, and hemoglobin is going to be normal. So this is what you should expect. A client is scheduled for surgery and has a history of OSA, obstructive sleep apnea. Which intervention should the nurse include in the post-operative care plan? Ensure continuous cardiac monitoring in the PACU, maintain the patient in the supine position during recovery, administer opiate liberally for pain control, monitor closely for signs of hypoxia and respiration and depression. What do you think? Which one will you do? What are you worried about in the patient in obstructive sleep apnea? Pause the video, pick your answer, and let me know. Respiratory depression, and therefore I'm worried about it. Literally, giving them opiate is going to surprise them. You got to be careful. There's no need for cardiac monitoring, and you don't need to place them in supine position. Place them in semi-fowler position is the best answer. The client recovering from surgery has absent bowel signs and report nausea and abdominal discomfort. This is breast care and comfort. What is the nurse priority action? Encourage the client to what? Ambulate to promote peristalsis. Assess for signs of paralytic ileus and notify the provider. Administer prescribed antiemetic and reassess in 30 minutes. Document the finding and continue to monitor. Take your answer. Let me know which condition worry you, which situation. I can tell you what you need to do. Let the doctor know. You worry. Nausea, abdominal distension, and absent bowel sound is a problem. Letting them walk, you're not fixing the problem. Giving them antiemetic, you're trying to fix it without knowing underlying problem. Document the finding and continue to monitor is not normal. And let's provide care for a client with CHF. Which finding is concerning? Congestive heart failure. Look for complication, not expected finding. This is B sharp moment. BNP of 350. Leg edema, saturation 90% on 6 liters, ascites, pay attention. Keywords, which condition is concerning, not an expected finding. Are they having complication from CHF? It's okay to have CHF, but if you have complication, that's the answer choice I pick. You pick your answer? I can tell you this is the right answer. Why? 90% on 6 liters, not even 2 liters. 6 liters, you should be like over 100%. But you stay on 90%. That means they're having respiratory issue. BNP greater than 100 is what? CHF. That's the definition. 350, fine. Like edema, expecting CHF. Ascites, expecting CHF. Respiratory complication, priority. And this is planning care for a client with what? Esophageal atresia and tracheoesophageal fistula. Which of the following interventions should the nurse include in a newborn plan of care? It's a newborn. He has tracheoesophageal fistula. What is the number one thing you should worry about? Is that's what the question is asking you. Test-taking strategy, common sense way. What is number one? Place the newborn in the supine position after feeding. Insert NG tube and begin feeding. Maintain the newborn in a semi-fowler position with continuous suction. Provide oral feed with slow flow nipple. Bunch of trap I gave you. You may pick something that is wrong, but that's NCLEX trap. The key word is tracheoesophageal fistula. Pick your answer. Let me know and I'll show you. You pick your answer. I know you picked the right answer. This is the key. This is the trachea, right? And this is the esophagus. Esophagus go from here and it stop. And the lower portion is connected to the trachea. And this go to the stomach. That's a problem. You cannot feed this kid anymore. You got to suction everything. Otherwise, they will aspirate. Any answer choice that say feeding, wrong answer. This feeding, wrong answer. Supine position, I'm going to aspirate. Suction them. Taking strategy here to use your content and the common sense based on what you know. And next is caring for a client receiving what? IV medication through a peripheral IV access. The client report burning at the site. Assessment reveal there's erythema, redness, and then there's fluid-filled blisters around the site. This is not normal, as you can see. IV therapy. Which of the following conditions should the nurse suspect? Is this infiltration, phlebitis, extravasation, hematoma? Go back to the buzzword, peripheral venous access, and I see red, I see edema, I see blisters. You pick your answer? I know you picked the right answer because you have to pick extravasation. That's necrosis. Infiltration, it get dark, it get thicker, it get cold. That's the area. There's no erythema. Phlebitis, you look for palpable cord. Hematoma, you see redness there, but no blood, bruising. Therefore, this is extravasation. The client is in labor and the fetal heart rate tracing show absent variability. That means there's no variation with recurrent deceleration. What is the priority in this intervention? Administer IV bolus of normal saline, prepare the patient for what? Emergency C-section, apply a fetal scalp electrode, encourage the patient to push. Take your answer, put it in the comment section. Let's take a week and get this 85 question, get over 65. I'm loving you because you've done a bunch of these questions. And so you should be confident. Every question, you know how to approach it, you know how to eliminate the wrong answer and stick with the right answer. No variability, bad problem. Recurrent deceleration, also bad problem. That means you have two things. We have no time. We got to deliver the baby. There's no need to give them fluid. This is not necessary anymore. Mommy should not push. If there is no variability, baby is dying. Baby heart rate has to go up and down. That's variability. And this is assessed in a group of clients in the pediatric clinic. Which finding the nurse should expect based on the age of the client? Hits. These are growth development and milestone. What do you expect? 1 month old, his head circumference is 33. Is that a normal? 1 month old, his chest circumference is 2 to 3 centimeters smaller than the head circumference. A 6 month old with the head, with the weight double that of his birth. A 6 month old with the closed posterior fontanelle. And a 15 month old with the open anterior fontanelle. Newborn physical exams. What do you think? If you don't know this, it's okay, we'll learn it. But don't over-select. Pick those that you're 100% confident. You pick all your answers? Yes. Average 1 month old newborn, head circumference has to be 33. And their chest circumference is like 2 to 3 centimeters smaller, right, than the head circumference. The 6 month old, your weight is supposed to double, and then at what? 12 months is going to triple. 6 month old, the fontanelle should be closed. And it takes 15 months for the anterior fontanelle to be closed. These are all expected findings. I put it there to help you. Know them, take a picture of it. When you see it somewhere, this is the way they will ask you. Trust me, this question, very, very important. I want you to take notice of all the landmarks I've given you. The community nurse is educating several clients in the community health fair about prevention of epiglottitis. community heard. What do you think? This is the way the new NCLEX will try to use this language to disturb you. Community nursing, same thing, preventive management, which is what? Health promotion. Which of the following the nurse should inspect, include, and prioritize? How do you teach them about epiglottitis? Most epiglottitis is caused by a foreign body aspiration. Exposure of allergy increases the risk of epiglottitis. There is no role for antibiotic in engaged management. Standardized immunization during infancy can prevent the disease. What do you think? Which answer choice you pick? I know you picked this because there's a role for antibiotic. It's not associated with allergy and it's not associated with foreign body. If you have immunization, 2, 4, 6, 8 months, baby will be free from epiglottitis. And then she's caring for a client at 38-week gestation receiving IV what? Oxytocin infusion for labor. The nurse note recurrent late deceleration in the fetal monitoring. Which action should the nurse take? Stop the infusion, place the client in the knee to chest position, start IV fluid, provide oxygen, notify the air care provider, recommend annual infusion. What do you think? Pick your answer, let me know. And I'll show you how to approach this question. It's a bunch of information, but I believe in you. I know we can get it. You know the content. Bring the content, use it to answer it. You pick your answer, I know you pick. Select or apply. It means don't over-select. What is the problem? Keyword, late deceleration. I say late deceleration, and I write my verb chop. And I see late, I say, oh, placenta insufficiency. That means I got to improve blood flow. And then I roll S lion. That means I got to stop my pitocin. I got to put lateral position, knee to chest. I need IV fluid. I need oxygen. I need the delta. No. Annual infusion is what? When I have variable deceleration. Therefore, stop the infusion, IV fluid, oxygen, air care provider. That's my right answer. The post-op client is anxious. That means you got to breathe very fast and breathing rapidly. This is the ABG. pH 7.48, CO2 30, bicarb of 23. What is the imbalance, acid-base imbalance present? What do you think? Pick your answer, let me know. You pick your answer? Common sense. pH greater than 7.4 is what? Alkalosis. That means, what are you going to do? What are you going to do? Acidosis is gone, acidosis is gone. And if I'm breathing fast, it's a respiratory problem. Respiratory alkalosis. Straightforward. You don't have to overthink it. In the community clinic, overwhelmed by what? A flu outbreak. There's a flu outbreak. They're overwhelmed. Which client should the nurse prioritize? 30-year-old. He has body ache, fever 101, and mild congestion. Flu, right? 72-year-old, fever, confusion, productive cough. Still flu, right? 5-year-old, sore throat, runny nose, flu-like symptoms. 40-year-old, history of asthma and wheezing. What do you think? Which one do you want to pick? Which one do you want to pick? Prioritization. Don't overselect. Don't get trapped. There's trap answers there. Pay attention. Just because you see a condition doesn't mean it's the right answer. The right answer is the older patient who has fever, is confused, productive cough, is more likely to decompensate. Just because you see asthma, he has wheezing. Asthma patient, I expect them to have wheezing. Sore throat, runny nose, good, okay. And all these things fine. 2 is in trouble. It's more likely, it's an older patient, more likely to have sepsis. He has higher priority than everybody. And this is monitoring a client in active labor. The fetal heart rate decreases to 80, deceleration during contraction. What is the next first action? The fetal heart rate decreased to 80 during contraction when the contraction starts. Document the finding, reposition the client, increase the pitocin, notify the air care provider immediately. What do you think? It's common sense. Test-taking strategy. Bring your content, maternity, labor, and delivery. We have deceleration. Pick your answer choice. You pick your answer and know the answer choice you pick, because I believe in you, because I know you know your content. And if I see deceleration, always position work. Whether what? Left lateral, knee to chest position, or stop pre-tossing. They say increase. Therefore, I'm not going to pick common sense. Don't pick it. Before I do that, I need to do something. You already know that it's always S lion, right? S lion. Stop the pitocin, do some position, IV fluid, oxygen before you notify the provider. It's not normal. Don't document it. Pitocin needs to be stopped. Notify the provider, the last thing. Therefore, positioning is the best. The next is collecting data for a client scheduled for what? Electroconvulsive Therapy. What is that? Which finding will the nurse report to the healthcare provider? Patient has a history of refractory major depressive disorder. Client report decreased appetite and anhedonia. Client has a history of what? Osteoporosis. And a client has a history of psychosis. This is one of my favorite questions because it requires some common sense and some test-taking strategy. You know the content, they give you a question, and you get distracted. This is NCLEX trap. These NCLEX steps I want to take for this question. Number 60. Put down your answer in the comment. Let me know. But we're almost closer. And let me know what you got for this. Be honest. Don't cheat. Put it down in the comment. What do you think? The right answer is osteoporosis. Why? Look at it. Electroconvulsive therapy, I'm creating seizures, right? To treat your depression. We can also use it to treat psychosis. If you have decreased appetite and anhedonia, you have depression. Therefore, what am I left with? I'm picking this, even if I don't know. This is the common sense strategy. Psychosis, depression, anhedonia, they sound like mental health problem. Therefore, I'm picking this. You're going to have fraction. If you have bad seizures, that's a problem. The next, prepare to administer prescribed Mantoux test to a client. Which statement by the client will make the nurse question the order? Which statement? Which statement by the client will make the nurse question the order? I am pregnant 6 weeks. I live in the shelter. I received IM influenza vaccine 1 week ago. I had a 15mm induration from a skin test 2 years ago. Which one you think is a bad idea for me to place the Mantoux test? You pick it. Pregnant patient can get PPD test. That's what they mean, Mantoux test. People in the shelter, they need to have PPD test. Whether you have flu vaccine or not, PPD test does not affect it. If you have had PPD test before, 15mm induration 2 years ago, that means it's a positive test. You should never have any more PPD tests. So this is a trap. That's the right answer. And let's provide care for a client suspected with opioid or withdrawal. Which symptoms should the nurse anticipate? Bradycardia, hypertension, urine retention, tachycardia, hypertension, diaphoresis, abdominal cramps, rhinorrhea, diaphoresis, irritability, hypertension, bradycardia. Pause the video, think about each condition, and pick an answer. Strategy: if one answer is wrong in among the three, all the three answers are wrong. That's the way. So look for one answer in each of them and then pick it and then ignore it. You pick your answer? Pick your answer. I can tell you, this is your right answer. Why? Opioid, what is that? It's the downer. That means if you take in opioid intoxication, your symptoms is supposed to do what? Go down. If you're withdrawing, symptoms is supposed to go up. Therefore, I'm looking for upgoing symptoms. Bradycardia is going down. I'm not looking at the rest anymore. Tachycardia up. Oh, I see hypotension. I'm going down. I'm not picking you. Abdominal cramps, rhinorrhea, diaphoresis, everything is going up. Irritability, hypertension, I'm going up. Bradycardia, I'm going down. Therefore, the rest is wrong. This is the way we answer these kind of questions. Otherwise, you get them wrong. You carry like focus, use the keywords, and you'll be fine. And let's provide care for a client with what? Eating disorder. Which condition is a priority the nurse should assess for in the client? Self-esteem, anxiety, feeling of anger, and poor coping skills. Eating disorder, anorexia or bulimia. Why did they do that? That's all it's asking. That's what the question is asking. It's not because they don't have poor coping skills, not because they're feeling angry or anxious. It's because of self-esteem issue. Next Generation NCLEX. Are you ready? I know you're ready. We have 10 more questions. This is the time people get weaker, they get weaker, and they get weaker. But at this time, when you have 10 questions left for your test, everyone can. Stay focused, build your stamina. If you're tired, go take a break in the bathroom, empty your bladder, and come back and stay focused. Freshen up and said, I'm almost close to 85. Therefore, let's get to it. It's a 10-year-old child arriving in the emergency room with the mother. Buzzword. Always read the first two lines and don't continue on. If you don't have a clue, please don't continue. But I know you got it. 10-year-old child arrived at the emergency room with the mother. That means something is not. Why would the kid come? It's a 10-year-old. The child is playing softball in the park and begin doing what? Wheezing and shortness of breath. Then you tell yourself, 10-year-old wheezing, shortness of breath. Everything I'm reading should come together now. It should meet the criteria of wheezing. The mother also reports runny nose. Oh, the kid is sick and sneezing. Is he has the flu? Mother thought the pollen in the park is making the child sick. Is it the pollen causing the problem? The child mother provided inhaler twice, but symptoms did not resolve. That tells you patient has what? Asthma. You see, you figure it out. Those are the vitals. Neuro-oriented, people equal, everything is normal. There's nasal flaring. You don't like it. Flare nasal discharge. Probably has runny nose. His eyes is watery with scleral edema. And then S1, S2 is present. There's no murmur. His capillary refills is less than 2 seconds. That means what? He's well hydrated. There's audible wheezing. He has an asthma. He's using accessory muscle. I don't like it. Subcostal retraction. I don't like it. Soft, non-tender, non-distended abdomen. Normal bowel sound. I make this very long to distract you like the NCLEX. It's okay. Keep on reading. You see the way I'm reading. I'm just ignoring. When I see something, I say, I don't like it. That's what you should do when you're taking the test. You said, I don't like it. That's key. The feet is warm. It's fine. No edema, no wet, no hives, no basically scratch mark at the upper chest. Probably has eczema or atopic dermatitis because he has asthma. Asthma is fine. Medication, you take Abodro and you're allergic to pollen. Probably pollen trigger the asthma exacerbation. That's all. You see how you analyze the question? And let's review the clinical data. Which finding need immediate intervention? Follow up. Nasal flaring, subcostal retraction, history of asthma, use of accessory muscle, nasal discharge, capillary refill of less than 2 seconds, audible wheezing. You can tell I'm trying to let you know that's what the NCLEX will do to you. Things that you know is worrisome, just pick it. Pick your answer and proceed. You pick them, nasal flaring, bad. Subcostal retraction is bad. If you have asthma, it's not going to change what I'm going to do today. Use of accessory muscle is bad. I got to stop all this thing. Nasal discharge, I'm not worried because it's associated with your allergy. Your capillary refill less than 2 seconds, you're hydrated. And if you have wheezing, I don't like it. The next, recognize that the major complication for the client current conditions were asthma attack, pneumonia, acute respiratory failure, and bronchitis. Pick your answer. Let me know in the comment section and keep track of your record. You pick yours. Don't pick asthma. It's a trap. We already know patient has asthma attack. Complication from asthma attack is respiratory failure. You can get pneumonia, but the most important is respiratory failure. So don't pick number one. It's a trap. Based on the clinical data, which prescription the nurse should anticipate at this time? If you have asthma attack, prepare for intubation, get a what? Chest X-ray, administer long-acting what? Beta agonist, give them hypertrophy, oxygen supplementary, give them steroid, give them magnesium, place IV access, and place the curve in the supine position. All the things you want to do. Extended selected apply. Which of these should you do? Prepare to intubate. Should you do that? Chest, start chest X-ray. Administer long-acting beta-2 agonist. Long-acting, pay attention. Administer long-acting beta-2 agonist. Administer hypertrophy. Supplementary oxygen. Inhale steroid. Magnesium. IV access. Supine position. What do you think? We're not going to intubate them right now unless they are not doing well. We can get chest X-ray to see what is going on. We're not going to give them long-acting beta agonist, short-acting. They will need hypertropium. They will need oxygen. They will need inhaled steroid. We're not going to give them magnesium right now unless they're not doing well. We place IV and we're not going to put them in the supine position. The nurse receives several orders. Which order the nurse should prioritize after inhaled short-acting beta agonist? After you give them short-acting beta agonist, what is the next thing? Steroid, chest X-ray, chest physiotherapy, incentive spirometer. What do you think? They need steroid. Chest X-ray we already obtained. Chest physiotherapy is cystic fibrosis, incentive spirometer. This patient cannot use incentive spirometer. The client continued to wheeze with oxygen saturation on 90% on 6 liters. Even though we give them too much oxygen, they're still on 6 liters. And they're still using accessory muscle. Which order the nurse should anticipate? This is what we call status asthmaticus. Status asthmaticus. What do you do with status asthmaticus? IV magnesium, IV steroid, epinephrine, quick flow value, metazanten, prepare for intubation. What do you do? What do you do? What should you include? Status asthmaticus, you need magnesium. It's going to relax the muscle more. They will need IV steroid. They will need epinephrine to take care of allergy reaction. Peak flow, use it in the beginning. Metazanten is for long term and you should prepare for intubation. Client recovers successfully from the prior intervention and ready for discharge. Now we want to discharge it. The nurse provided home management teaching on asthma. How do you manage asthma at home? Which statement by the mother indicate ineffective teaching? Which statement by the mother indicate teaching was ineffective, right? My child should have used Sumatriptan for cortisone the first onset of attack. Is that okay? When you have asthma attack, this is what I should use. I give them Sumatriptan for cortisone. My child will use what? Montelukast for long-term management. My child will use peak flow meter frequently to check for disease control. I will average the peak flow to monitor the child best. My child should move the reading gauge all the way up before the peak flow. These are conditions you got to teach them to be familiar with. And therefore, we go to one by one. What do you think? Pause the video, pick your answer choice. My child should have used Sumatriptan for cortisone the first onset of attack. When you have first onset of attack, is this medication appropriate? My child will use Mantoux for long term. Is Mantoux used for long term? My child will use peak flow meter frequently to check their controlled disease. I will average the peak flow rate to monitor my best reading for the child, and my child should move the gauge when they're doing the peak flow. What do you think? Ineffective teaching, fluticasone and salmeterol is not used for rescue in an acute problem. It's for maintenance. My child will use Mantoux for long term. Mantoux used for long-term management of asthma. So that's not appropriate. It's not for acute. My child will use peak flow meter frequently to check for disease control. That's what you do. I will average the peak flow to monitor the child best. You should not average it. My child to move the reading gauge all the way up before using the peak flow. That's ineffective. You should not touch it. My child will use the flow meter frequently to check for disease. That's good. My child will use Mantoux for long term. That's good teaching. My child will have used salmeterol the first onset. Ineffective teaching. So the question says ineffective teaching. My child, or ineffective statement. My child should have used salmeterol fluticasone the first onset. This is ineffective. My child will use Mantoux for long-term management. That's good. My child will use peak flow meter frequently to check for disease. That's effective. I will average the peak flow to monitor the child best, that personal best. That's wrong. My child should have to move the reading gauge all the way up before using the peak flow. No, I emphasize it so that you can pay attention that it's ineffective. The only effective is B and C. And this is the next generation NCLEX. How did you do? A newborn blood glucose level is 45. What would we do? Encourage breastfeeding immediately. Place the newborn under a radiant warmer. Administer formula or glucose gel as ordered. Notify the care provider and prepare for transfer to the NICU. What do you think? The first thing you ask yourself, is the patient symptomatic? Pick your answer choice. There's no symptoms. Breastfeeding, mommy can give it to them. Newborn warmer is for temperature. Formula, if the baby can take anything, and talking to the doctor is not going to help you. And next is what? Caring for a client receiving TPN. Which finding require immediate intervention? Patient gained 1 kilo in 1 week. There's mild edema. Glucose is 420. Patient is complaining of anger after infusion start. What do you think? Pick your answer. Let me know. But what? Glucose is too high. A newborn assessment, the next note, a caput secundinum. Caput secundinum on assessment. What is the most appropriate next action? Is it a bad problem? Apply ice to the affected area. Notify the care provider immediately. Reassess the area during routine care. Document the finding as normal and provide no intervention. Newborn assessment. This is expected, is trauma during birth, and therefore CS crosses suture line, it may go away. Reassess it in the area during care. The ice is not going to help it. The doctor, you don't need to, you can notify them, but not immediately. Provide, this is normal finding, but you should provide some intervention. You got to check it, make sure it's not getting bigger and bigger. And let's provide care for 4 clients with chest tube connected to the closed chest tube drainage system after thoracotomy. Which client situation need immediate follow-up? That means bad problem. How do you master chest tube? Know what is every chamber, their function, and what you should expect. Once again, know every chamber and what is the function. Check adapt and class for content like that. But if you don't know anything about chest tube, make sure you know everything about the function of the chambers. So continuous bubbling in where? Suction chamber. Intermittent bubbling in where? Water cell chamber. no fluctuation of fluid column in the water cell chamber, and blood thin fluid in the collecting chamber. Which of this is normal? That's all. Suction chamber is supposed to bring air. You can see continuous bubbling. Water cell chamber, you should expect intermittent bubbling. There should be no fluctuation of fluid in the water cell chamber. That means there's no tightening. Bad problem. In the collecting chamber, there may be small blood fluid there. That's fine. Therefore, this is your right answer. A 6-month-old present with intermittent abdominal pain, carrying jelly stool, vomiting, abdominal distension. I've given you buzzword for a condition. Which action should the nurse prioritize? Antibiotic. Start oral feed to prevent dehydration. Prepare for barium enema. And prepare for surgery. A 6-month-old present with what? Intermittent pain, carrying jelly stool, vomiting, and abdominal distension. What is that? Pick your answer, let me know. There's interception. If you have interception, what do? Prepare for barium enema. You don't do surgery right away. Oral feed, no. Antibiotic is not needed. And this is teaching a new parent about safe sleep practice for a newborn. This statement by the parent indicates the need for further teaching. We will place the baby on the back to sleep. Further teaching. We will remove soft toys and blanket from the crib. Further teaching. We will swaddle the baby tightly for every nap. Further teaching. We will use a firm mattress in the crib. Further teaching. Which one? Further teaching. Which one? Placing the baby on the back is good. Soft toy and blanket from the crib to prevent suffocation. Swaddle the baby tightly for every nap. No, just let them loose. And mattress should be firm. And this is determining which clients require mechanical lift for safe transfer. Who do you think need mechanical lift? This is a fundamentals, safety. Which of the following clients would the nurse need a mechanical lift? You will see this question is busy, but it's not. There's only one word there, mechanical lift. Whose condition require mechanical lift? Think about it, common sense way. Who do I need to lift if I got to move them? Think. I with bilateral lower extremities paralysis and no upper body strength. They have no upper body strength. Client who is obese morbidly and unable to assist with transfer. Client with severe arthritis who cannot stand but struggle with pain during movement. Client who is unconscious or minimally responsive. Client who is cooperative and can bear weight but need guidance during transfer. A client is recovering from a major abdominal surgery and restricted from bearing weight. Who? Who do you think? Pick your answer, let me know. If you cannot move, can't support yourself, upper extremity is weak, and your leg is weak, I got to lift you up. I can't break my back. Morbidly obese, he cannot assist himself. Same boat. Severe arthritis, but he can stand. He struggle with movement, so he can help with that. We can still assist them. Client is unconscious, and he can't do anything. I'm cooperative. You can tell me I will do it. I can bear weight. Yeah, that's fine. Abdominal surgery, restricted from bearing weight. Still, we cannot let you do it. You can't bear weight, and therefore we got to lift you up. 2 more questions. How are you doing? Like I said, this is the area where people get weaker and weaker and weaker. Stay strong. Hold on the fire. 2 more questions. If this is your rare exams, 2 more questions to be on the other side. Let's get this one done. And this is our session 10 Mantoux in an outpatient clinic for routine where they will visit. The parent wants to know when the client will be ready for toilet train. How do I know I can go to the bathroom? Your child will tell you when he's ready. Hey, mommy, I'm ready. I got to go. You will know when the child has voluntary control with will occur 18 to 24 months. That means voluntary control. They can hold and stop at that time. Your child will be toilet trained by 15 months. Your child will be ready when able to dress and undress himself. If you can dress and undress yourself, am I ready? By 2 months, they should be able to. They don't have toilet train. Your child will be able to toilet train 15 months. That's far-fetched. Your child will tell you when ready. Well, they can tell you when you're ready, but they're not ready. You'll be ready when they undress. They can undress and dress themselves, but they don't have bladder control. So that's not. And the last question. And this is performing physical assessment on the client of different age. Which of the following assessment strategy are appropriate for the specified client? Select or apply. Encouraging a preschool age child to sit quietly, remain still throughout the entire assessment. Is that what you tell them? Allow a toddler to hold a what? Stethoscope before what? Auscultation to reduce fear. Explaining each step of the assessment to a preschool using simple, clear language. Asking a school-age child for permission before touching them during the exams. Performing the least invasive assessment first when assessing an infant. Conducting head-to-toe exams without parental presence for a teenager or required privacy. Which one? Pediatric. Growth and development. Hospitalization effect. Select or apply. Pick those that you are 100% confident. Don't overselect. Preschool, they don't want to sit still. They want to touch the equipment. Don't do it. You got to provide some magical thinking for them to be able to do that. Allowing the toddler to hold, that's what they do. They hold it, they get distracted, reduce fear. Each step to a preschool in a simple, clear language is much better. And then what? Magical thinking for them is good. Asking a school-age child for permission before touching them during the exams? No. School-age? No. Performing the least invasive assessment first when assessing infant so that they don't pick up. Conducting head-to-toe exams without parental presence for teenager, yeah. Privacy is big for them. This is NCLEX practice question, NCLEX questions and answers. I know you get more than 65, but if you never get them, you know exactly what you do. In the next video that will show up, I will link a video, another 85, to try your readiness. I know you get it. If this video helped you, subscribe to Adapt NCLEX for more content like that. And check the video that come up. Watch it again. Keep on doing it. And I know I believe in you. You pass these exams. Take care of yourself and good luck.